In the past, I have done stories on the hepatitis A outbreak among the drug addicts and homeless in San Diego. Well, guess what, ladies and gentlemen? There is another outbreak related to the nation's opioid crisis, hepatitis C. It's inevitable, especially when people are out here using needles and, sharing needles. These things are going to happen. It just can't be avoided. This is West Virginia. The nation's opioid plague has unleashed a secondary outbreak, the rampant spread of hepatitis C. New cases of liver disease have nearly tripled nationwide in just a few years, driven widely by the use of needles among drug users in their 20s and 30s, spawning a new generation of hepatitis C patients. Because a treatment that cures the disease costs tens of thousands of dollars, is limited by insurance and Medicaid, and mostly unavailable to people who are still using illicit drugs. There's probably will be financial and public health ramifications for decades to come. Here in West Virginia, which has the largest rates of overdose deaths in hepatitis C and hepatitis B infections, public health officials are attempting to identify as many new hepatitis carriers as possible and are girding for decades of repercussions. If we don't cure a significant number of people who are injecting, in 20 years from now, the hospitals in this part of the world will be flooded with these people at the end stage of liver disease, which has no cure, said Judith Feinberg, a professor of behavior medicine and psychiatry in West Virginia University School of Medicine. I can see it coming at me like the headlights of a train, just coming and coming and coming. And I'm thinking, doesn't anybody want to jump out of the way? The number of new confirmed hepatitis C cases nationwide rose from 853 in 2010 to 2,436 in 2015, according to the Centers for Disease Control, a 15-year high. But tens of thousands more are believed to have contracted the disease without knowing it. According to the CDC, 34,000 people were estimated to have contracted hepatitis C in 2015. A number public health officials believe is low. So they're estimating it low. In Massachusetts, the officials estimate 300,000 have the disease. Wow, 300,000 people got hepatitis C? Oh man. And half of them receive a formal diagnosis. Testing for the disease is not widespread because it's impossible to not display any symptoms. Hepatitis C often goes undetected for decades until it manifesting in severe, life-threatening liver disease. It is unidentified. That scares me, said Raul Gupta, West Virginia's health commissioner. What I am afraid of is that there are people out there not in the medical health care system and they're spreading the disease. Across the nation, health providers are seeing a cascade of public health consequences unleashed by the opioid plague beyond the significant rise of overdose. Increases in hepatitis B sexually transmitted diseases, including syphilis and gonorrhea, elevate rates of endocarditis, an infection of the heart seen in people who inject drugs, higher rates of emergency room visits for abscesses, and hospitalization for soft tissue infection. Some that become so severe they require amputations. Wow. Some places are seeing small increases in HIV. Now, I know in rural areas, especially in the South, because of the drug use, HIV is like going through the roof. And there is widespread fear that an outbreak like one in Austin, Indiana, where nearly 200 drug users contracted the disease in 2014 and 2015 because of sharing needles, could happen again. Part of the solution, public health officials believe, is what happened in the wake of Austin, opening syringes exchanges so that users can access clean needles. Long controversial syringe exchange are becoming more broadly accepted in wake of the opioid plague. That's because I think they come to the realization that they're not going to stop this thing. That's really all they can do is make sure they get clean needles because they're not going to stop these people from doing drugs. In Kentucky, 20 have opened since the state legislator approved them in 2015. In North Carolina, at least 25 have opened since they legalized last year. Hepatitis C was once associated with baby boomers who contracted the disease before the nation's blood supply was screened for it starting in the 1990s. And with urban drug users, about 3.5 million people nationwide have hepatitis C. Three-quarters of them baby boomers. Nearly 20,000 people die of the disease in 2015, the majority of them over the age of 55. Now, new carriers tend to be young people who use intravenous drugs. Health providers in an array of locations from urban Tennessee to suburban Boston to Baltimore are reporting increases in hepatitis C diagnosis. In West Virginia, the number of hepatitis C cases is 9 times the national average, and Medicaid costs for treating the disease amounted to more than 27 million from 2014 to 2016. Gupta said West Virginia is seeing major increases in syphilis and gonorrhea cases, which he believes are due to drug use. Wow. Well, West Virginia has always been one of those states that had a big problem. You can have direct consequences of needle injections and the consequences of impaired judgment, Gupta said. West Virginia has aggressively tried to track hepatitis B and C cases, expanding testing in state syringe exchanges, jails, and prisons. Gupta said one reason the number of hepatitis cases here is so high is probably due to the fact that the state is aggressively seeking them out. Thousands of people each year stream into West Virginia Health Right Free Clinic for clean needles, medication, and staff hopes a hepatitis C test. About half of the clinics have hepatitis C. Chief Executive Angie Settle said discovering through a rapid results test the clinics offer. The clinics, which send mobile dental units around the state to offer free dental care, has started sending staff along to test people for hepatitis C. Wow. Yo, this is crazy. You got, because of this drug plague, you got syphilis, gonorrhea, AIDS, hepatitis A, hepatitis B, hepatitis C. Wow. You know, and it's really many different STDs that are rising because of this. Because, there's a lot of people out here having sex for drugs. I mean, let's face it. And they're going to share needles. You really can't avoid that, especially, if they're doing heroin. I mean, they can try as hard as they want to, but ladies and gentlemen, these people are going to be dropping like flies soon. If the drugs don't get them, the diseases will. And that's just the way it is. And it's even worse when they don't show symptoms. If they don't show symptoms, who's going to go get checked? Wow. Please tell me what you think. I will leave the link to this article in the description. Um, Please leave your comment and subscribe. And if you can make a donation to my channel, please do. Peace, family.